Thank you so much for your time. I hope it's made a difference.
Great. Thank you so much, Dr. Chesney. That was some great information. So I took a lot of notes during your
Oh, great.
talk.
Thanks.
So we've got about 12 minutes or so for Q&A. So if anyone would like to ask any questions of Dr. Chesney, you can raise your hand in Zoom and we will try to get to your questions. And real quickly, so how does your protocol differ from the protocol of most medical professionals when someone comes in fearing that they may have been exposed to Lyme?
Right. So it can be a range, even for those folks. Um, you may just be told to watch and wait, or you may be given a one-time dose of doxycycline after a tick bite, which that study is not very effective, it doesn't give confidence. So it's a flawed study. I'd recommend any health care providers to read it. Um, but yeah, so they might get a one-time dose. If they have symptoms, I hear all sorts of things. They might be given 10 days of doxy. They might be given 14 days, uh, you know, but they might come back to their provider saying, well, some of my symptoms went away, but not all of them. And they may not be given more treatment. And also, anyway, the round form and the biofilm are not being treated. So that's not going to be an effective treatment necessarily. Or what if there's Babesia there? It's not being treated. So, there needs to be more critical thinking. But if a panel's given, sometimes they pick it up. A blood test panel at a later date, they might pick up Babesia and treat that properly. Yeah, it's really all over the board, I have to say.
Yeah, so
And
it's
that's
very
when I see someone, because they say, I think I still might have this. And this is what I was given. I'm like, you're only given one dose and you had an erythema migrans? Oh my goodness. Uh,
yeah, it gets definitely a little confusing out there.
yeah, yeah.
Um, a lot of people that are on this that are following this conference are very reluctant to take antibiotics. And you talked about essential oils as being an alternative. How do they compare as far as their efficacy in, either prophylactically or with dealing with the symptoms of Lyme disease? Is essential oils an alternative to antibiotics, or do we need to take antibiotics? Should we get
Yeah, so are you meaning essential oils or herbal botanical
or
medicine?
herbal
Or maybe
botanicals? I'm
both, maybe
sorry. Yeah,
both.
there you go. No herbal, whatever the alternative is. How about that?
Sure, sure. So yeah, because no, there are also, I don't know what the question is coming in. There are also essential oils that you can take safely orally, that can be an option um, as an alternative. And there's research on that. It's just so great. I've been practicing since 2010, and I have mentors that I've learned from. And, you see in practice, that these herbal treatments and these natural therapies work clearly, right? And then there's some research to come out, which just feels really validating, and can gain some more access to just the medical field at large, and people at large to see that it really works. So yeah, what I see typically, and I do use pharmaceuticals in the beginning of acute Lyme and tick-borne disease. I do see that there's something to that. Um, I've had patients, and I happily work with them. After we talk about it, they may not want to do that, and we may choose to do a natural therapy right off the bat. And sometimes that's been just fine. Occasionally, it's come back, and we've said, you still have these symptoms. It was acute. It should be easily treated. Let's do the antibiotics, and they may do that, and they may see a difference. And that's acute, right? So if we're talking chronic, if somebody sees me who's been sick 10 years, 20 years, they've been to many doctors, nobody knows what's going on, or they had pharmaceutical antibiotics in the past, but are still sick, often we'll start with natural therapies because they're going to be more effective later on for sure. Sometimes I just like to capture that moment where the pharmaceuticals are most effective right after a tick bite acutely. I hope that
So,
helps.
Thank you. Yes. So Lyme disease is known for being difficult to detect. There seems to be different criteria based on who you go to for whether or not you have Lyme disease. What makes Lyme disease so uniquely difficult to diagnose and even define, and get agreement among the medical profession? And then what advancements in diagnosis and treatment have you found promising in your practice?
Yes, yes. It's a little bit of a mystery, and there are a lot of different ideas out there as to why why this is so hard, right? Doesn't necessarily make sense. But regarding everybody getting on the same page and having access to the same treatment and utilizing, this knowledge that is out there, that's a little bit of a head scratcher. But yes, we could get into all sorts of theories on that. But to stay in the solution today, um, I would say regarding testing, that's one of the issues. So testing, the ELISA test is usually the first test that's done by a conventional practitioner, and that one's less than 50% accurate. So we didn't have time today to go into all this, but that's certainly important. And it is actually like if you read the test, what's included there is to say this test is for surveillance. So this is not a diagnostic test. It says that on the test. However, practitioners are using it as a diagnostic, meaning it's really used for epidemiology, for public health. Like, all right, how much Lyme disease is out there, right? Let's see. But it's not a test that should tell us you have Lyme or not. It does not rule out Lyme. And unfortunately, practitioners use it that way. Actually, everybody's in agreement that this test should not be used to rule out Lyme. So if it is positive, yes, there's Lyme. You've been exposed to Lyme. If it's negative, nobody should use that test, and no one's actually being told to use that test to say you don't have Lyme. So that's annoying. That's confusing. So there's that test. It's really a clinical diagnosis, and the CDC says this is a clinical diagnosis. It's not just about this one test. So it's about putting that in action and having proper education about it. So we're using the clinical picture, meaning the symptoms, what happened? Hey, you had a tick bite. Oh, and then you got a fever. Let's treat you. Let's not wait for this test that's not very accurate to come back. Then the timing of the test. So you have to wait 4 weeks after a tick bite to even get that horrible accuracy anyway, whatever the accuracy is, which is under, it's like 20 to 50%. But it'll even be worse if it's not done 4 weeks after the bite. There are better tests. So I use the Western Blot. You can actually order a Western Blot at a regular hospital or Quest Diagnostics LabCorp right off the bat. However, some hospitals, which I've run into, they will not do it. So for instance, Quest Diagnostics, if a practitioner goes in there and orders, like, this is the test I want, that is the test that will be given, which is great. I've had problems with hospitals where I choose that test on my order form and I do not get that test back. They do the ELISA test and I say, I don't want that test. I want the other test. And they say, well, we won't do that for you, which is really a problem.
Mm.
So that's a long story, but making sure you get that Western Blot, which can sometimes be hard to get, is the thing. And that's going to be a little better. That's going to be 60 to 70% accurate. So better than that other test of the ELISA test. Even still, right? So you get a positive, okay, it's positive, but you get a negative, it doesn't rule it out. So we have a company called Igenex I work with, Igenex. They've been doing this for a long time. They have a Western Blot that is 90% sensitive. So it is usually out of pocket. It's covered by Medicare. That's the Medicare Part B is the only insurance that covers it. Otherwise, it's out of pocket. It's $450. And then you have to find a doctor. You can find a doctor at ilads.org if you're looking for a Lyme literate specialist. And then they would be aware of these things, hopefully, right? And they might order that test. If you ask your conventional doctor to order from Igenex, I doubt it's going to happen. But anyway, that exists, and that's a much better test. So now we can say, oh, 90%, okay, maybe this can rule it out or rule it in. But still, I'm going to be looking at the clinical symptoms. And then also just to squeeze in, because it was exciting last year, 2023, we now have a culture test from Igenex, and that is the gold standard to tell us, do you have a pathogen? Do you have this infection, right? A culture. So it's looking for the actual bacteria, and now we have that ability. So you can also get a Lyme, or actually it's called borreliosis, because it's looking for all Borrelia, which is also really nice because it's more than Borrelia burgdorferi, which is why some of those other tests are less accurate. So it looks at all Borrelia and can tell us, do you have an infection now? Because all the other tests, even the better accuracy tests, are just telling us if you have been exposed. They don't tell us if you have Lyme now. And maybe that's all we need to know because we have your symptoms as well. But for people who have had Lyme in the past and seem to have resolved it, it becomes a problem then. How do we retest? And that's where we use the culture.
So what? All right, so we have about 1 minute, so I'll just ask
Okay.
to be brief, which I know there's so much information on this.
Yeah,
But
yeah.
real quickly, what might be some of the reasons why some people are symptomatic and others are not symptomatic when they have Lyme disease?
Yeah. So, I mean, we need a robust immune system in order to mount a response and have symptoms. So that's a player. I've had patients who have immune deficiency syndromes, diagnosed clinically. And yeah, who knows when they had Lyme, but they are dealing with it as well. And if you don't have a robust enough immune system, you may not get symptoms. I mean, that could be a small part of the population, right? Um, and also, it can be blamed on other things. I mean, with COVID, I've been having these conversations with patients a lot. Oh, I had COVID, but then something else, and I had a tick bite, and then I had RSV and an upper respiratory. It's like, there are so many infections out there that you could get, and trying to decipher what's what, can be hard as well. Um,
Great, thank you. So, all right, that wraps up our time. So, thank you so much for sharing that information. And real quickly, what was the website where people can find the practitioners?
yes, so ilads.org, ILADS.
ILADS.org.
.org, yes.
Okay,
There's
IL.
also, so that's the medical society that I was talking about, the other guidelines. So you can go there and fill out a form to find a practitioner near you. Yeah.
All right, great. Thank you so much for all the information that you shared with us today. If we could unmute the audience so they could share their appreciation for Dr. Chesney, that would be appreciated.
What do you
Thank you so much for your time. Thank you so much.
Thank you.
Thank you.